The IV went in at 5:06 a.m. By 5:13, George Klein was dead. That was the first red flag. George had just undergone a routine heart procedure at Hollow Creek Medical Center in Austin, Texas. At 58, he was doing better than expected. Alert, talking, even joking with the nurses. Then suddenly, after a dose of pain medication, his vitals plummeted, code blue. Doctors tried everything. They failed. One death isn't unusual in an ICU. It's sad, but it happens. What raised eyebrows was what happened next. Less than 18 hours later, another patient died. Same wing, same night shift nurse, same medication logged. His name was Joseph Herron, 61, recovering from abdominal surgery. The notes showed morphine administered at 2:32 a.m. By 2:41, his monitor flatlined. 2 deaths in less than a day. Coincidence? Maybe. But the attending physician flagged the file, and something didn't sit right. Neither patient had shown signs of complications. Neither needed high-dose morphine. Then came the third. July 14th, 3:18 a.m. Rebecca Lynn, 54, recovering from a gallbladder removal, coded just 11 minutes after receiving her IV. The same nurse signed off the medication, Claire Wexley. It was her 5th year at the Hollow Creek. Quiet, competent, and always the first to pick up extra shifts. No complaints on file, no drama. Just another face in blue scrubs, the kind you trust implicitly. But suddenly, trust was off the table. Claire was scheduled to return the next evening, but she never showed. She didn't call. She didn't respond to texts from supervisors. When the hospital called her emergency contact, it bounced back. Number no longer in service. That's when the hospital brought in security. They pulled surveillance footage from the previous nights and quickly zeroed in on something chilling. At 4:48 a.m., just minutes before George Klein's death, Claire was seen exiting the restricted med supply room. Her sign-out log showed 2 morphine ampules, yet the patient files suggested at least 6 doses had been administered. A search of the ICU's disposal bins uncovered 9 empty vials, their serial numbers scratched off. Nurses don't destroy barcodes. Ever. Claire's co-workers were stunned. She wasn't just good, one said. She was the calm when things went to hell. But Claire Wexley had vanished. Detectives from the Austin PD were called in that same afternoon. They visited Claire's apartment on East 9th Street. Inside, the air was stale. The windows were shut. There was no forced entry, no struggle. But the place was strange. The closet was bare, drawers emptied. There was no toothbrush, no food in the fridge. The only sign someone had lived there was a still warm cup of coffee on the kitchen counter. And under the sink, detectives found something that turned their stomachs. A gym bag filled with scrubs soaked in bleach. The Hollow Creek Medical Center logo had been slashed off with scissors. Tucked inside a zipped pocket, there was a sticky note, water damaged but still readable. It wasn't about them. It was about her. At this point, police assumed they were looking at a serial poisoner. Toxicology reports on all 3 patients revealed a shocking twist. There was no morphine in their systems. Instead, each one had elevated levels of potassium chloride, a lethal compound that induces cardiac arrest and metabolizes quickly, often evading standard post-mortem screening. Someone had swapped the IV bags, and that someone was now missing. By day 4, the story had broken nationwide. Angel of death. Nurse vanishes after triple fatality headlined local news. Social media tore Claire apart. Was she a sociopath? A serial killer? A rogue healthcare worker out for revenge? Then came a break in the case. A hotel manager in Wichita Falls, Texas, called in a tip. A woman matching Claire's description had checked into the Mulehorn Motel, paying cash under the name Marissa King. Detectives obtained security footage. It was Claire, hair chopped short, wearing a hooded sweatshirt and dark sunglasses. She left the room at 4:15 a.m. and never came back. In the waste bin, investigators found syringe caps and tubing. On the nightstand was a manila folder labeled Patient Files. Inside were copies of medical charts, including George Klein's, Joseph Heron's, and Rebecca Lynn's. On each file was the same handwritten phrase, "I only gave them what they begged for." And beneath them all, a fourth file, Dr. Marissa King. This name hadn't come up yet. A quick check revealed she had died 5 years earlier from an apparent overdose in the Hollow Creek parking lot. The toxicology report had said fentanyl. She'd been a junior doctor, young, bright, ambitious, and, as it turned out, Claire Wexley's ex-girlfriend. Court records showed the two had broken up months before the overdose. Friends described the split as messy. There were rumors of manipulation, even blackmail, but nothing was ever proven. Dr. King's death was ruled accidental. Now, investigators had a theory. Claire didn't just break, she snapped. And something in those three patients, perhaps their cases, their medications, or even how they reminded her of a King's death, triggered a calculated revenge spiral. FBI profiler Dr. Elias Granger was brought in. He reviewed Claire's background and painted a chilling picture. She's not a thrill killer. She's not even angry. She's reenacting something she feels was stolen, and she believes she's restoring balance. In Granger's words, Claire is at war with a ghost. 8 days later, a woman was found barely conscious outside an urgent care clinic in Santa Fe, New Mexico. She had chemical burns on her arms, a hospital band with no patient name and no ID. When she regained consciousness, she whispered, "Claire Wexley." But before police could arrive, she vanished. Left behind in her bed was a syringe, half filled with clear fluid, and a post-it note. It wasn't about them, it was about her. The search escalated into a federal manhunt. Tips flooded in from across the country. Former colleagues remembered Claire doing travel nursing contracts in Utah, Oregon, Pennsylvania, Nevada, and Georgia. None could confirm whether patient deaths had followed her there. A deeper dive uncovered something darker. Over a dozen unexplained ICU fatalities across 5 states, all on nights where Claire had charted medication. As the task force assembled files, one pattern stood out. All victims had once been patients of Dr. Marissa King. They were elderly, post-op, or recovering, just like the ones at Hollow Creek. Was this revenge, or something deeper? Authorities fear she may still be active, under a new name, a new identity, in a new hospital. Some believe she's already found her final target. Others think she's saving that for last.